fixing backs and dropping facts.
That's right, son. You're so good, man. You're so good.
Too easy, man.
I know,
Too
right?
easy. Hey, how you doing, guys? My name is Kai Blick.
And I'm Tom Larson.
And we are the boys
of Bass.
Coming at you like kamikaze, fixing backs and dropping facts. Here in the middle of the clinic, doing some good old content creation. We are now on episode
12.
Oh my goodness.
Bro, come on.
Oh my goodness. 12. 1 and 2, baby.
We've been talking about this process, rehab process, going head to toe.
Yeah.
Today we're talking about anterior hip pain.
Yeah.
Now, commonly people complain of pain in 3 different areas in their hip.
Yeah.
The front side, the outside, or the back side.
Yeah.
And it can all be a little different, stuff that's going on, but it could be the same stuff too.
Yeah.
So, but today we're talking in particular about anterior hip pain,
right.
Which I'm a victim of. I mean, I've had it. You got it too, right?
Man, still like my eyes. Yeah. Yes.
So just
short answer, yes.
People go, "Oh, you're a therapist. You shouldn't have pain."
No, far from the truth. Far from the truth.
I like to do too much cool stuff, so I'm always getting in pain.
Yeah, it's like physicians, like a physician not getting sick. Everybody, it's just, you're not, you don't get a pass on going through what life gives you. So,
but having these kind of issues helps us become a better therapist.
Oh, for sure, for sure, because you kind of can relate and say like, "Hey, this will help me," and kind of get an idea of what could be contributing to that pain.
So most of the time when it's anterior hip pain, we're talking impingement of the hip.
Sure.
The hip joint is binding up in the socket there. Big causes of that can be a weak, tight psoas, right? So this muscle that's deep inside here comes down into your leg. So one of the 5 hip flexors or primary hip flexors, the only one that gets your knee over top of your hip.
Yeah.
But that one gets weak and tight. And the problem is people go, "Oh, it feels tight in their hip," and they'll stretch it.
Yeah.
Okay?
Right.
The problem is that it may give them temporary relief, but because it's tight and it's protecting, it's going to tighten back up again, and can create more issues. So we really have to address the weakness.
Right.
But if we just start strengthening it without reducing the tone with massage, because the first step's got to be massage, it's going to make it tighter.
You're strengthening an already tight muscle.
So we dive into it manually. We'll get in here deep inside the front of the leg or the abdominal wall, and work our way through the psoas. We'll teach people how to do that massage technique with the psoas.
Yep.
A lot of times they have glute issues too, so we'll use the ball on their glutes.
Yeah.
Groin adductors tie into the psoas too.
Those adductors are always like, more times than not, every time I deal with a patient that has a tight psoas, 10 times out of 10, that groin, the adductor gracilis, those muscles down there deep into that groin area is always on fire.
Terrible.
So painful. It's so
terrible.
Painful. So painful.
Terrible. So we massage those muscles out first, right? We reduce the tension. So there's a lot of tension in there. We reduce that tension. Then we have to activate them. Right. So we activate our stabilizers, and we go through a series of exercises on the mat table to activate stabilizers. Particular one for that are dead bugs. Right. And we'll get that hip flexor going. Yeah. Right. Yeah. We're re-educating the muscle on how it's supposed to work. Yeah. Right. So we'll do our dead bugs, and then the thing that a lot of people get pain with is squats.
Oh yeah.
That pinching. Pinching there. So once we massage our tissues out, we activate our stabilizers, activate the psoas, then we update the computer by squatting.
And a lot of times I notice like sometimes you got to find that muscle I'll do a TheraBand around the legs, kind of just so you can start engaging the right muscle. A lot of times we don't realize it. We're very quad dominant. A lot of times what we do is when they're trying to start, which another thing is that quad muscle is a 2-joint muscle, so it goes over the knee and over the hip. So same thing, tight hip flexor, another hip flexor serves as a hip flexor. So when you're going down trying to do a squat, a lot of times people, man, my hip, because you're using all these but not using these back here. So I like to tell people, hey, engage it. Like, oh, that actually feels better, or whether it's on their knee or whether on their hip, to where it's not as pinchy or as uncomfortable when you're squatting.
Well, what you're engaging is the external rotators of the hip. Right. So external rotators in the shoulder, ball and socket joint, hip, ball and socket joint, create stability at that joint. So the more stability you can create at that joint, the more weight you can push, right? And the less likely your brain is to recruit other things like psoas to try to help stabilize.
For sure. And then you'll see people doing, like I say, you'll see people because of their tight hip flexors when they're trying to do a squat, or tight calves are doing this way forward trunk excursion and everything. And that's another thing is, like I say, you just kind of change that habit, change the moment of how they're when they're bending down and how it's changing how they're going down. Exactly. Like if it's going more anterior, hey, there's something that's tight. What is it? What's contributing to that tightness as I'm moving down? So it's crazy, man.
Yeah. And that psoas muscle, that's such a fascinating muscle, and people never think
nobody
of psoas.
And it's like even when I was in school, the psoas was never like that. Was never like, oh, you have back pain, you gotta massage their lower back and like all that kind of stuff. But this is one of the muscles that it goes like nobody pays attention to.
But that's the thing too. Like we talked about last episode, that increased curve in your low back, so as being a problematic issue for that. Well, it could cause that back pain, or it could cause anterior hip pain. So it depends on where's the pain manifesting itself for that patient at that time.
Yeah, and it's even. I remember I was doing some research before, and it was like on snapping hip syndrome or whatever, where that tight psoas is running over the ilium or that pelvis bone. Is because it's tight. It's kind of tight. When people have too much mobility but not enough stability to kind of control it, it just starts ripping and running all over things. So that psoas is a bugger. Filet mignon on the body, baby. The filet mignon.
I mean, if I had to eat you, I'd go right there first.
You eat your filet mignon. Cannabis.
Really comes down to that.
All right, go for it, man. That's the meaty one. That's the one that gets everybody. And it's so crazy because there's some people you get in here and like you go in there and it is like on fire, but you don't feel a lot of muscle tone in there. Like, and it's a real weird feeling because people just think when they think here, like, oh, that's just your abs. All you have is the rectus abdominis, but the muscle goes deep. And I don't know if we've kind of given an idea where, like, it sounds crazy, but you can literally palpate in here. You'll feel a muscle, and you go a little bit inside. You can feel the person's spine. Your body is not that much depth to your body to where it's like people think that's my back. Why are you going through my stomach? So you can feel this muscle and it attaches to the spine, so it can contribute to the low back pain.
Yeah, and then you get them to raise their leg up, and that psoas will pop right up in your thumb.
It is not fun. It is not fun, but no, it's not a fun muscle to work. But man, it can do numbers when it comes to relieving low back pain or tight hip flexors or tight hips in the front pain.
Right on, man. So I guess until next time, go out, live, work, and play better inside your body. Peace out.
Easy peasy.